There we go. Okay, right on time. So thank you everyone who was able to make it, and those of you who cannot make it, you'll be getting access to the replay. So thank you nonetheless for registering, and I really hope you're able to get something useful out of today's webinar. So thank you so much for taking time out of your busy Wednesday to come and join us. So this topic is one that comes up again and again, and I have a Facebook community where I provide free trainings to dietitians on different topics, and I've had lots of conversations. And every month and a half, I do a poll and I ask the dietitians there, what do you want the next training to be on? And then they vote. So for this masterclass, this was the topic that won, and it's how to approach clients who aren't making progress. So I believe most of you can relate, therefore why you're here. And I hope you find this helpful. So before we get started, I'm going to go ahead and introduce myself. For those of you who don't know me, my name is Joyce Faraj-Ardura. I am an assistant professor of nutrition and dietetics at Framingham State University. I am also a nutrition counseling coach, and I am the founder of the Nutrition Counseling Academy. I specialize in training dietitians in the foundations of behavior change, motivational interviewing, and just effective communication strategies to help them make a bigger impact in their client sessions, so they can really help their clients and keep their clients for as long as they need to, leading to better results and hopefully better revenue, so they can really support their clients' transformation. So disclosure, I am the founder of the Nutrition Counseling Academy, so I will be making reference to this throughout the presentation. And those of you who signed up and are here live will be getting a CEU certificate for one continuing education unit as soon as I get it approved, so it's pending. So you should be hearing back from me in maybe a week or two with an email with the certification of completion for the CEU. I will be sending that out, so keep an eye out for that. By the end of this webinar, my goal for you today is to take you through the key and simple strategies that you can use to assess why your clients might not be making progress and what you can do about it in your sessions. So I'm hoping you're going to take some tangible tools that you can use in your sessions, some questions, so feel free to take some notes when I get to the tips and the strategies section, so that you can go ahead and just start using these in your sessions. And if you do use them, I'd love to hear back from you to hear how that went. So by the end of this presentation, you're going to have some key strategies to be able to know where your client might be stuck and identify ways to support them in your sessions, so you can help them move forward towards behavior change. And the reason this presentation is different is because I'm showing you some of the tactics that are evidence-based or used in practice, but not often taught in school. And I know that because I've been teaching counseling for the past 5 years at the college level, and I know the material I inherited is very similar to much of the material that's out there. So I've changed a lot of the material that I teach my students upon having conversations with dietitians, but also it's a little bit different to learn this and to learn these strategies when you're actually seeing clients versus when you're a student. So I hope these are able to resonate with you. And if you stay until the end, I will be sharing some bonuses as well. Okay, so how do you know if this masterclass is for you? Have you ever felt imposter feelings or inadequate because you should know how to support your clients when they're stuck and they're not making progress? I've been there. If your clients and you might be feeling frustrated because you're not making progress, you're not quite sure how to figure out what's going on, you're doubling down on nutrition education, that's not working, you're not alone. You have an innate ability to connect with your clients, but you're not quite sure how to move them forward towards behavior change without being pushy or imposing. We've all been there. And you sometimes feel that something might be missing in your training, and therefore you can't really make the impact that you wish you could be making in your clients' lives. This is common. You want to provide your clients with the best experience possible. You care deeply for your clients, and maybe you even feel guilty that your clients aren't making progress, or you're feeling drained by your sessions. And all these are common feelings. I'm just here to tell you that if any of these sound familiar, then you're in the right place and you're also not alone. I've been there. I'm sure many of you either are or have been there in the past. So I hope some of these strategies are going to help you overcome some of these. And this is not for you if you enjoy having clients who drop off the radar after 2 or 3 sessions. That was not me. I felt really frustrated. I would take it personally when clients weren't coming back, but I didn't realize that there was so much more that I could do on my end to kind of figure out what was going on. This is not for you if you prefer to go straight to doubling down on nutrition education and or planning without figuring out why your clients might not be making progress. I apologize for the outside noise. Or this is not for you if you feel that you are solely focusing on nutrition education in your sessions and that's the best way to go. This is also not for you if you're an expert at counseling, like at the Molly Kellogg or Don Clifford level. I don't know how much you might learn from this presentation if you are at that level, but if any of the things resonated as to why this masterclass is for you, then I'm happy to have you. So I'd like to start off by asking you a few questions, and I'm going to try to make this a little bit interactive. So on a scale of 0 to 10, how do you feel about your current nutrition counseling skills? 0 being you're feeling some imposter feelings, maybe you're very new to counseling, you just finished your dietetic internship, or 10 being that there's no way I can get better at this. I'm amazing. All my clients stay with me as long as they need to. Like I said, the Don Clifford or Molly Kellogg level. And honestly, if you're a 10, then you should probably be teaching this. So where do you think you stand? Okay, wonderful. Getting lots of different numbers. Okay, so we got a mix of experience here. Wonderful. So then secondly, I would like to do some self-reflection. And a big reason for this is because I do this with my clients as a dietitian and as a nutrition counseling coach. I believe self-reflection is going to be key to lasting improvements. So I would like for you to take a minute and think about why you're here, right? How do you feel that not improving your, So how do you feel that not improving your nutrition counseling skills, or kind of staying at this level, let's say, affects your clients? How do you think that would affect you? So I'd love to hear from, and feel free to share it just with me. If you don't want to share with everyone, you can send me a direct message, or you can feel free to share with everyone so that people can, feel in solidarity with each other. So how do you feel that keeping your counseling skills at the level that they're at might be affecting your clients? Someone mentioned, makes me want to close down practice at times, not making the difference I want to. Because you care deeply about your clients. You want to be able to make that difference, right? You may be providing outdated advice information. Oh, and we know with nutrition science, there's always new information, right? But I'm going to make this clear distinction here, that nutrition is a science. Medical nutrition therapy is a science, but eating is a behavior. So there's that distinction there, right? I've had some clients, patients not making changes and can't find a way to get through to them. Oh, that's so frustrating, right? When you're trying to figure out how to really make an impact and how to really, find the way in so that you can finally make things click in your clients' heads. Absolutely. So thank you all for sharing. And then how do you think this might be affecting you, whether professionally or personally, maybe emotionally? In what areas of your life might this be trickling down to? And the reason I asked this is because when I started, I felt very little confidence in my own counseling skills. I was a top student. I did all the homework, I did all the things. But then when I started seeing clients, it's like, oh my goodness, I don't quite know how to do this. What am I doing? Am I being fair? Am I providing the service that my clients are expecting? And me second doubting myself in client sessions led me to second doubt myself in other areas of my life. It led me to second doubt myself in, meetings with the whole department or in meetings with the medical team. And I realized that I had to do something about that. Doubting how much I can charge. You're doubting your value, the value you can provide as a dietitian. Absolutely. You might be feeling like you might be failing sometimes. I was there, and trickled down to not just failing in my client sessions, but failing in other things. This like perceived low self-efficacy for what I was doing with my clients was trickling down to other areas. And it was really hard to come to terms with that. But when I realized that by improving my counseling skills, I kind of started getting confidence to also improve my interpersonal skills and my skills, and the value I provided as a member of a team changed. So I'm going to share some of the things that I learned throughout my journey as well, because I went from feeling inadequate at times as an imposter, like, what am I doing here? I don't know what I'm doing with my clients, to figuring out how to go into a solution-focused approach and take the attention out of me, but towards others, towards my clients, towards my teams. And then that made me feel much more valuable. And maybe I wasn't contributing, like big things. I didn't have like big achievements when it came to things that I would say, but my responses were thoughtful, and I was asking questions that led other people to think. And then I felt much better about how I was presenting myself to the world. So I'm here to tell you that none of this is your fault, because we were not trained. We were not trained to be able to do this well. And although the Academy of Nutrition and Dietetics recommends that dietitians incorporate proven counseling methods such as motivational interviewing to help clients facilitate desired behavior change, we're not always given enough opportunity to learn, practice, and master such skills in our training. So as much as they can say, you're going to enter the workforce being fully competent in this, and that, there are just so many things that go into the curriculum that it's going to be nearly impossible for the behavior change aspect to match the science aspect of the training that we get in our dietetics programs. So as dietitians, we're experts at systematically applying the nutrition care process framework, figuring out the diagnosis, we do the assessments, the diagnosis, interventions, monitoring, evaluation, but we are feeling like we're not really quite ready to do that intervention of counseling very well. And to me, it's communication and counseling. It's how we do what we do. So then how can we do our job well if we're lacking a big piece of this? So for most RDs, our current training leaves much to be desired when it comes to nutrition counseling to support behavior change. Like I mentioned, nutrition is a science, eating is a behavior. And how can we separate nutrition from eating? They go hand in hand. So we need more training when it comes to behavior change, and how can we support our clients' behavior change? Typically, we get a big emphasis on nutrition education. We're experts in nutrition education, not so much in counseling. And communication skills often not emphasized to use compassion and empathy to be able to build a therapeutic relationship that we need to establish with our clients. But instead, we tend to learn more a prescriptive or directive approach, where we are the experts and we're telling our clients what to do and how to do it most of the time. I'm not saying this all the time, but most of the time. And this doesn't really lead to relationship building. It doesn't lead to those things that are going to help you retain your clients, make a bigger impact, get better results. And if you are in the realm of private practice, which some of you might be, all those things are going to lead to better revenue. If you're not in private practice, if you're working for an employer, all of these things are going to help you show value as a dietitian, right? So my take on nutrition counseling skills is that the counseling skills that you have to help your clients tackle behavior change are just as important as the nutrition knowledge you have to support those changes. Nutrition counseling, nutrition science, just as important. And a recent survey of dietitians, this was published last year, 94% of practicing dietitians who already are a registered dietitian, right? 94% of them reported that they thought it was necessary to get post-registration training on communication skills for behavior change. So you're definitely not alone. You're all here for a reason. 9 out of 10 dietitians who are practicing feel like they're not quite equipped to have communication strategies that are going to help propel their clients forward when it comes to behavior change. So then let's move on to nutrition counseling skills and client retention. How can improving your counseling skills help you with client retention? Before we get started with this particular area, this might not apply to all of you, but I'm just curious, how many of you are into private practice or would like to move into private practice? And how many of you are working in other environments? I'd love to hear where you might be working. Okay. Wonderful. If you are not in private practice, I would also love to hear what setting you work in as a dietitian, or what setting you would like to work in if you're currently looking for employment or trying to switch areas. Ooh, behavioral health, wonderful. Private practice, okay. Great, thank you. Thank you all for sharing. Just gives me a good idea of where my audience is. So if you own your private practice or you want to move towards private practice, you're probably working really hard at trying to figure out ways to get clients. Maybe you do discovery calls, maybe you get referrals. What it comes down to is that your nutrition counseling skills will get you out of any potential cycles where you're working too hard and your clients may not be getting results. Let me tell you, enhancing your counseling communication skills are not only going to help you help your current clients, they're also going to help you get more clients or get new clients. And our goal as dietitians is to show our clients how we can support them as long as they need our help. It might be 2 months, it might be 6 months, but if we're only really tackling nutrition education, we're not supporting them through their behavior change journey. So if we don't know how to guide them and interact with them when they're struggling and when they're not making progress, then we're not really doing them justice. And this view really does empower dietitians because it just indicates that there's lots that we can do as professionals to create a great client experience, to be able to support them and to retain them for as long as they need our help. We don't want to retain clients forever. No, we want to be able to retain them for as long as they need our support. Hopefully our goal is to get them to a point where they can fly on their own, right? But in order to get there, there's lots of different steps that we need to go through. And it's not enough to just provide the education, a little bit of support, and then they're off on their own, because then we know that behavior change is quite challenging. In order to make it really sustainable, we need to be able to know how to support them through their struggles. So I'm going to go ahead and say that if we're not able to retain our clients, we're doing lots of hard work getting clients, and then we miss out on great opportunities to help them as long as they need our help. Now, the Academy of Nutrition and Dietetics and their weight management practices, they recommend, and again, I'm not like a weight-centric approach dietitian, I'm a weight inclusive, but I wanted to share this because this is what they publish. So according to the Academy, they recommend around 6 months of nutrition counseling with meetings every other week. So that's around 14 sessions for 6 months. For someone that is in the preparation action stage, trying to reach maintenance. So when they're actively in the weight loss phase. So it might be even more for someone who is not quite ready if they're still in pre-contemplation. If anyone has worked with clients on behavior change, you know it usually requires 6 months or even more to be able to sustain sustainable changes. Every person's different, but usually, we want to aim for a little bit longer. So if you see clients on average 3 times, and then your clients are leaving or they're stopping your services after 3 sessions, then you should be seeing them around 14 times in 6 months. That's a huge missed opportunity for you to help them and to make a bigger impact on their lives to achieve their health goals. And I'm going to say that's also money left on the table if you're in private practice, because it's sessions you're potentially missing. So if they show up to 3 sessions, they drop off the radar, that's 11 sessions you're potentially missing. And just hypothetically, if it's an average of $120 per session, then that's roughly $1,300 that you might be missing or losing potential earnings if a client decides to drop off the radar after 3 sessions. And if this happens with 50 clients a year, that's over $60,000 potential dollars of lost revenue. So again, we want to work with clients until they've made sustainable changes, but if they're leaving after a couple of sessions, we're not really able to do that. And then we're doubting ourselves, right? So I want to say that this is not just about finances, but can you see how this might make sense? But if you're not able to get a client to work with you long enough to get results, then you cannot really make a lasting impact. And our communication and counseling skills would be a strong predictor of our client retention rates. So this is if you're in private practice. Let's say that you are working for an employer. With enhanced communication and counseling skills, we can show our worth as an employee. So many of you might be working in a larger company. You don't own your private practice. If this is your situation, then you're likely going to need to negotiate your salaries or promotions or raises every so often, maybe every year. And your nutrition counseling skills will only enhance your value as a competent employee. I can tell you from my experience working in a larger organization that my client no-show rates and client satisfaction were key factors that directly influenced my negotiation points when I was having those discussions with my higher ups when it came to raises and promotions. So if you keep track of any of your no-show rates, and if your company in any way surveys clients for their client experience or client satisfaction, these are 2 KPIs or key performance indicators that you can use to negotiate your worth as an employee. You could take it an extra step actually and show how much more revenue your services might be adding, and you'll be in a better position to get a raise as well. So that being said, what if instead you felt more confident in your ability to create a strong therapeutic relationship with your clients that helps you support and retain your clients longer, and you knew what to do to be able to do this? And I have a typo there, my apologies. So today we're only going to be covering actually 3 strategies and 6 tips. 6 tips. So I ended up adding more tips, but we don't have enough time to go through all of it, right? It can take a long time for someone to be able to really master this. But as we all know, the masterclass is a short time that we're going to have together today. But at the end, I would like to share what the Nutrition Counseling Academy is able to offer. And there's going to be a few of you who might want some additional guidance and support to really enhance your client experience, increase your client retention, make a bigger impact in nutrition counseling sessions. I understand this won't be for everyone, but if and when I start sharing options for additional support, you realize you don't need it, feel free to jump off. Otherwise, feel free to, stay. So, but if it is for you, and if you really want to hear about how I can help you solve your nutrition counseling struggles, then hang in there. Is it okay if I share this information at the end? Just type a yes in the chat if it's okay with you. And if you're interested in learning about more services, either it's free services or free trainings or actual programs that can help you support you longer term, then go ahead and type it in. Okay. And you're going to know when this comes. So if you're not interested, feel free to hop off. Okay. Thank you. Okay. So let's get started. This is my actual framework. And I realized that dietitians don't want just another course. So I created a framework, which I'll talk about towards the end. And this came about from my conversation with hundreds of dietitians about how they might be missing the how to do effective nutrition counseling, if that's even a sentence. But they want the coaching and immediate feedback. They want to be able to implement this, apply it, and be able to do it with their clients in real time. So if you are tired of just having another course or reading another book, go ahead and type 1. If you would like to learn about the how to and be able to implement it, then go ahead and write implement. Implement if you would like to learn more about how to implement all of these different aspects. Okay, so wonderful. Let's get started then. Dietitians who are skilled in counseling understand what their clients are going through. They have a better ability to be able to put themselves in their shoes and be able to respond to their clients in a way that builds that sense of connection. They know how to support their clients even when they're struggling. They meet their clients where they're at. They're able to adjust their counseling strategies and approaches based on their client's unique situation. They don't stress out with client sessions and don't work more than their clients. They don't let client resistance get the best of them. And they're more likely to retain clients longer, get better results, and get more revenue. So that being said, is there any reason not to enhance your counseling skills and get the support you need to take your skill set to the next level? If we know that this is what any professional wishes to feel fulfilled when it comes to doing the client work. So one last self-reflection before we get started. What would mastering counseling skills allow you to do? How would it enhance your client sessions? And why is now the best time for you to work on your skill set? I'm going to give you a minute. And again, self-reflection is a big aspect of my practice. So I like to incorporate this into the sessions, into the master classes as well. So you can feel free to share with me only or share with the team, with the whole audience, I mean. So how would, let's say, bring your counseling levels to the next level or your counseling skills to the next level? How would that enhance your client sessions? What would that do for you, you think? Take a sip of water. It's about getting my clients better and longer lasting results. Yeah. Feel more confident, improve client motivation, increase client retention. Now we feel more confident. Yeah, so it's twofold, right? It's like feeling more confident, more fulfilled as a professional, but also knowing that you're supporting your clients the best way that you possibly can. Absolutely. Thank you all for sharing. So a little bit about me, if that's okay, I'd like to share a little bit about my background. So I went to UMass Amherst. If anyone else went to UMass Amherst or went to Western Mass, go ahead and say hi. I did my undergraduate there in nutrition, and I loved how the body worked in conjunction with the immune system, so nutrition, immune system, and I ended up doing a double degree, nutrition and microbiology. And then I ended up staying for my master's in nutritional science, and I did my PhD in public health, nutrition, and mental health. And then I was hired by Mountainside Treatment Center, and I was hired to create and manage a nutrition program from scratch in a substance use rehab center. And I thought, okay, nutrition, mental health, there's a good combination. And I started learning more and more about substance use recovery, and that became my area of specialty: nutrition, mental health, substance use. And I created this awesome program. I knew who I was going to see, when, how often. I know all the ins and outs. And then I started seeing clients and I realized, oh my goodness, my counseling skills are really bad. I need to do something. Luckily, it was a blessing that I was the only dietitian working there. All my colleagues were therapists, social workers, psychologists, psychiatrists. So I was able to, sit with them during lunch and hear their conversations, go to all the team meetings and start hearing how people talked about behavior change, go to their own trainings and workshops, getting a lot more training in MI and realizing there's a lot more that I can learn so that I can feel more confident. And I would sit in and shadow them and I would get supervision. So I started learning all these things until I felt much more confident. I could see the difference in my client sessions. I could see the difference in how they responded and how I was able to adjust my approach based on where the clients were at. It was no longer me coming up with like 10 goals. It was no longer me overwhelming my client. It was me actually paying attention to my client, empathizing, validating, and coming up together with solutions that made sense. So it was an approach that it took a while, but it was small changes here and there that allowed me to see how the environment in the client sessions was very different once I was able to adjust and implement new strategies. So then I moved into academia. I was hired as a tenure track assistant professor, and I've been teaching nutrition counseling, medical nutrition therapy for the past 4 or 5 years at Framingham State University. This picture on the top was me presenting at Fancy last year. And I'm also a mom to 2 little girls, and I have a little boy on the way, as in really soon. So that's me in a nutshell, and realizing that my students yearned a lot more when it came to nutrition counseling, and yet our curriculum was so packed. And I talked with other dietitians and they all said, yeah, like I wish there was more out there when it came to enhancing my nutrition counseling skills. Getting a book here or there is wonderful, but there's so much more that I need. I need that support, that mentorship, that coaching, that supervision to really be able to, feel more confident in my own skills. So that's when I developed the Nutrition Counseling Academy. I funded this last year, and here's the link in case anyone wants to join the Facebook community. I provide training every other week or so, and it's under the guide section. I have over 20 free trainings there. I also have a YouTube page that's new, and I have an Instagram. So that's my journey. So now for the next half hour, let's dive into the strategies to explore your client's lack of progress and what to do about it. So are you ready to dive in? Type yes in the chat, and we're going to get started. Throughout this talk, I'm going to be sharing a client story. Her name is V. So V worked on me one-to-one coaching and then joined my Elevated Nutrition Counseling Blueprint and with weekly group coaching support. V was consistently getting clients that reported being super committed and motivated, but 2-3 sessions in would respond to her, yes, but, and they would start seeing lots of like obstacles on the road. They would start seeing, they would stop making progress. Every suggestion she provided, they would be like, yeah, no, maybe. So week after week, we started working on implementing some of these strategies to support her clients where they were at, while also promoting compassion, respect, and curiosity. And I'll show you how I coach V through this process. So we have to consider how clients are feeling when they come to us. They might be feeling, they might be having some negative experiences, have had negative experiences, failed attempts at behavior change. They might be feeling overwhelmed. That being said, they might be feeling overly ambitious too. They might be lacking confidence. They might be lacking knowledge. And if knowledge is all that they were lacking, nutrition education would, do the trick. But most often than not, nutrition education is just one small part of the puzzle. That is a good complement to counseling, but it's only one piece of it. Many of them might be perceiving too many barriers. Many of them might not be sure how to move forward. And we might be underestimating how much our clients actually know. They might know quite a bit, but they don't know how to put things into action, what to prioritize. So that's where we come in. with our behavior change expertise and not just our nutrition education expertise. That's where our counseling skills are going to be able to shine to build a therapeutic connection and help our clients with their barriers and attitudes so they can feel supported, like they can actually do this. So behavior change is quite complicated, and it's much more complex than just having the knowledge to change, which is why education alone is not going to cut it. Regardless of which behavior change theory you look at, there are similarities amongst them. And many of them have to do with the client's own attitudes and beliefs about what they can and cannot do. So I'm going to go ahead and share 3 strategies. The first one is about exploring the client's attitudes towards behavior change. The second one is tackling limiting beliefs and barriers. And the third one is using a strength-based solution-focused approach for your conversations with your clients. Now I'm going to get started with the first one, exploring attitudes and expectations. You want to know what your client has tried in the past. What has allowed them to be successful in the past? What has made them give up in the past? At what point in their journey do they just, throw their hands in the air and say, I give up? What would have been needed to be different for them to have been successful in the past? And what are their expectations of this journey with you? Because it's not whether the client will struggle or not, it's a matter of when they're going to struggle. Behavior change is not easy. Everybody struggles. We have to normalize that struggle. So learning what they think and believe about behavior change is going to be useful, not to be able to dissect the root cause problem of their failures. We're not going to be wanting to dwell on their failures. No, we want to learn about what they've tried in the past so we know how they perceive the behavior change journey. We have to explore their attitudes towards change. We need to let our clients know what to expect as well. And we need to take them through the behavior change journey and the process. And they have to know that it's not easy. Otherwise, everybody would do it. There would be no use for like therapists or dietitians, right? Let them know that they might struggle, and that's going to be normal. And actually, it's when they're struggling that they might need to see you the most. So we started to feel more comfortable setting guidelines and expectations towards the beginning by using some of the examples I provide in the next few slides. So the first tip, it's not enough to just ask what they've tried in the past. This is probably a very common part of your assessment, but we also need to dig a little bit deeper into their attitudes towards change. So this might not only give you insight about your client's attitudes, but it can also help the client gain some insight about their own attitudes. And this can help you get insight into how they approach change and what to do when challenges arise. So we should be expanding our assessment to also include questions like what worked, what skills or strategies helped you make it work in the past? What didn't work? What do you think would have made it work? So look at this. I'm not focusing on the what didn't work, and I'm not staying there, but I'm reframing it into a positive. What do you think would have made it work? So you're allowing your client to think about what a potential solution might have been in the past. So maybe that's something that we can discuss once again when something does come up. Third question, what could have made your past attempts feel more sustainable? What would you like to be different this time around? Because if they probably tried things in the past, they're there to see you for a reason. They've tried it on their own and it hasn't worked. So they probably have some experience with what has worked, what hasn't worked. And it's because of this experience, this life experience, that our clients are the experts of their own lives. And we have to tap into that expertise so that together, 2 experts are working and collaborating towards helping them solve their problems. Okay, tip number 2. When clients first come to see you, explain the process of change. The predictability will decrease their doubt and can help them with commitment, so they know what to expect. Recognize that behavior change is not easy. And what is normal, like struggles will be normal. It'll be normal for them to have high motivation days and low motivation days. It's going to be normal for them to see obstacles, but they have to know that the expectation might not be the reality. So when we talk about what to expect and what is normal when it comes to behavior change, we also have to talk about managing their expectations. So working with a dietitian does not mean smooth sailing. It does not mean that it's going to be the image on the left, right? It doesn't mean they won't struggle. It doesn't mean they won't have low motivation at times, but it will mean that they will have the support they need to come up with a different strategy as needed when working with you. There's going to be some trial and correction. I prefer this term to trial and error, because there's going to be trial and correction because you're figuring out a better way, right? And they're going to be better equipped to tackle those low motivation days because you will have done a good job at digging into their big why for behavior change. If you know the foundations of behavior change and you're able to apply them in your sessions, this is going to make your job a lot easier. You're going to feel like you're being more effective. And then knowing that ongoing support will be key for their journey to be successful. So when we started digging deeper into her clients' reasons for change, their deep motivations and emotional reasons for wanting to change, and pairing that up with the questions to assess their attitudes towards change, not only did her clients understand the process better, but they were more likely to remain patient when they weren't seeing immediate results. They were able to better handle that frustration. Her client retention went up. She could feel a better connection with her clients. She was building and reinforcing the therapeutic relationship, which is a big predictor of client change and retention. So now moving on to a second strategy, tackling limiting beliefs and barriers. Most of your clients' reasons for struggling to start behavior change or to make progress will likely have to do with their own perceived beliefs of what is possible. Now I'm going to go into the top reasons for clients being stuck. On the client's end, it could be, does the client believe they can actually change their behavior? So do they have the confidence and the self-efficacy that they can do so? But let me tell you, low perceived self-efficacy is one of the biggest barriers to someone starting behavior change. Are the clients perceiving their efforts to be worth it? So do the pros outweigh the cons? And if not, change won't happen. If they're perceiving too many barriers, they're not going to be able to move forward as well. Maybe they have regressed in their stage of change. Maybe they're no longer in the action phase. Maybe they're moving backwards to contemplation or pre-contemplation. And we have to know what strategy to use when they do that. Does the client believe that, I already said this one, that they can overcome their barriers? And there's more barriers in the next slide. Do they have the appropriate knowledge, skills, education, support to be able to move forward with the goals that they established? On the dietitian's end, have we spent enough time evoking behavior change? Have we overwhelmed the client with too much potentially? Is the plan personalized? Is it practical, doable within the client's means and abilities? And in my program, I go into how to tackle each of these situations as well. Well, let's go into tip number 3, and it has to do with these barriers. We have to explore our barriers in depth. It has to be a part of your assessment to explore the barriers in depth, because everybody has barriers and they need to be discussed. If barriers are stronger than benefits, change is not going to happen. So by discussing the barriers with your clients, you provide a space to be able to talk about what's getting in the way and together work towards a solution to their problems. Now I'm going to go ahead and say that barriers can be tangible, like lack of resources, or they can be intangible, like psychological barriers, mindset and perceptions. For example, a perception of low self-efficacy is a barrier. Them not believing that change is possible is a barrier. A very common barrier is the all or nothing mentality, which we're all familiar with. So I teach my clients how to help their clients identify the small wins and tackle these intangible barriers through behavior change strategies. Because they don't need to be all in. They just need to be in when it comes to the all or nothing mentality. And for someone who's been all or nothing, black or white thinking for a long time, they need to have these conversations so that they don't give up the moment that they don't do things perfectly. They need to be able to have some flexibility, right, in their thinking, because that's going to be key for sustainable change. I would want to ask them, how has having an all or nothing mentality affected their behavior change efforts in the past? Maybe they could share that in the past they were doing really well according to them, and then one meal just, made them blow everything out of proportion, and they stopped following whatever behavior change journey they were on. And then hopefully that can make them realize that having this mentality is not really helping them meet their goals. So then we can also talk about their values and what they value, what their goals are, and what the things that they might be doing are supporting them to get closer to their goals while acting in accordance to their values, or the opposite. How what they're doing does not align with their values and is not getting them closer to their goals. So sometimes it's just about planting a little seed to get them thinking about how what they're doing and their mindset can help them get closer or farther away from their goals. Another one is, what needs our current behaviors meeting? We have to consider that every client has different behaviors that they're maybe trying to get rid of, or they're trying to add new behaviors that might be replacing other behaviors. The thing is that their current behaviors are meeting a need. So if we're trying to change their behaviors, then we have to figure out how else can those needs be met. And that's something that we often don't think about. If we're replacing something in their life, what need might be left unmet because of that change? And lastly, how is their attitude towards gains or losses, or wins or falls? How can we help them focus on long-term gains while reinforcing the short-term rewards? For example, let's say someone might want to reduce the amount of medication they're on. Maybe they're on like really high doses of blood pressure medication. But short-term gains might be knowing that they can now walk up the stairs without running out of breath. Maybe they're able to walk 10 minutes straight, or maybe a mile or two, when at the beginning they were only able to walk 5 minutes and then they were done. Those might be small wins that they might not be recognized as wins, because they're thinking, I'm still not there yet. I'm still taking the same amount of medication. I'm still not able to run a 5K or whatnot, but these are improvements. And it's going to be up to us to champion our clients and help them reflect on the wins, whether they're behavioral wins or they're mental wins. Because in reality, everything that goes up until action is going to be mental. In order to support action and maintenance, there's a lot of mental work that needs to happen. So being able to celebrate some of those wins is going to be key. For example, even if the client just gains insight into their hunger fullness, even if they keep on eating and they realize, I overdid it, I ate more than I should have, there's a win there. There's a win, the fact that they recognized that they were getting full and they should have stopped. Even if they didn't stop, they at least recognized it, so that next time they're able to hopefully act on it. So those are the things that I'm referring to with gaining insight and those mental processes that maybe they might consider a failure, but it's actually is a win, because they're now able to recognize something they weren't able to recognize in the past. So once V started planting the seed of doubt that the all or nothing mentality might not have helped her clients succeed, her clients started to shift that mentality to consistency and frequency, and learning to celebrate the small wins, no matter how small. And it took a little while, but they were able to have these conversations in each of their sessions. And then that really made a difference in their clients' attitude towards their sessions and towards themselves, because clients can be very self-critical of how they're doing, right? As humans, we tend to focus more on our failures and the one thing we did wrong versus the 20 things we did right. And that's just the way our brain works. So V had taken lots of webinars, workshops. She had read the MI books, but was not yet a success story, as she puts it. But working with me was a game changer for V. It changed how she delivered her program to her clients, how they responded, how they now have more self-reflection for results rather than looking for V to make the changes for them. She could immediately tell what a difference it made to start digging more into the big why. And V had been an RD for over 15 years when we started working together. So this goes to show that having experience with the wrong strategies just means you're repeating the wrong approach again and again, and you have lots of experience with that. So it doesn't matter whether you're a new dietitian or you've been working for a long time as a dietitian. If you feel that there's room for improvement, then there probably is. The third strategy, strength-based solution-focused approach. Now, coaching is necessarily, it has to be a solution-focused activity, because coaching is going to focus on where people want to go, how they're going to get there, and how they're going to achieve the results they desire, rather than where they have been or what has happened to them in the past. In counseling, we tend to combine an exploration of the past attempts in order to understand the client's attitudes towards change, help them process that. And once we make that pit stop, we move on to focusing mostly on a collaborative, solution-focused, strength-based approach where we facilitate our client's behavior change journey. So what I'm aiming to do with dietitians is combine both of these so that we're able to understand the client's attitudes from past successes or failures and transpose that into their current behavior change journey using a solution-focused, strength-based approach. So we can empower our clients with this strength-based approach, and we can focus on the positive attributes that they have, their inner resourcefulness and their inner wisdom, and this will positively influence how they process their thoughts and emotions as well. The solution-focused part is an essential part of coaching, and it's about asking the right questions instead of telling people what to do, but it's about asking the right questions to guide them towards problem solving so that hopefully they can do this on their own and they will no longer need us. So when we combine strength-based and solution-focused approach, we have the communication strategy known as motivational interviewing. And this does not focus on alleviating the symptoms per se or getting to the root cause, but it focuses on overcoming the barriers, the obstacles, and gives the clients a sense of confidence in their ability to manage their own problems. It ultimately empowers clients. So tip number 4, focus on the client's goals, highlighting their strengths and expertise to achieve those goals. Not your expertise or your strengths, but the client's strengths and expertise. So a key feature of a solution-focused approach is that it begins with the process of identifying easily accessible solutions to issues that clients want to work on, rather than being fixed on problems. And I'm going to say that clients will not resist what they want to work towards if they truly want that. If they're working towards their own goals, they're not going to resist that. So by imposing your own agenda on someone, you're going to create resistance. I talk a lot about resistance in my program because we, wanting to fix our clients or help them, we can inadvertently be creating resistance in our clients. So we have to allow for their voices to be heard, and we have to create conversations that are going to make them feel comfortable sharing their expertise as well. We have to emphasize their autonomy throughout the session. And this can sound something like, it's entirely up to you what you decide to do. I'm here to support you and guide you. Because this can also help with accountability and keeping your clients accountable for the goals that they set for themselves. And this is not your responsibility. The burden or responsibility for behavior change should lie on them, not on you. So as far as resistance goes, V realized that she was imposing her own agenda on her client sessions and getting lots of yes, but responses. So she switched it up and started to let clients choose the agenda while guiding the sessions in the direction of behavior change towards target behaviors that they knew they had to work together towards using my strategies. And this made a world of difference for her. So there's a little snapshot of these before and after. At the beginning, V would send me this text message and she said, "Oh my good God, Joyce, help, help, help. I just got off the phone with one of my difficult clients and I am absolutely stuck. I am in so much need of help." She's trying to put into words her struggles. She is not opening up to me. She has hangups inside that I can't get out. She's feeling super stuck since she had something medical I had to take out of there. And it's been difficult. She's been super frustrated, but she's also not willing to do anything. Really help. I didn't know how to pull this out of her, but she was getting a lot of yes, but responses. You can see the frustration in V's text here. Now, after working with me in the Elevated Nutrition Counseling Blueprint program, she sent these 2 messages. I wanted to write last night, but was too tired when I got off the call with my client. It went beyond excellent. And Joyce, I attributed that success call to working with you. I seriously couldn't have had so much success without having worked so hard with you. She had a pretty huge epiphany during our call that she was pretty amazed by. She was so happy and comfortable by the end. She couldn't stop telling me how happy she was to be working together. I was practicing my reflections hard and really digging into her why and her goals and what she values. And I had to laugh inside. When I got on the call, she looked nervous. I asked her how she was feeling about being on the call and getting things started. Because I asked that, she admitted that she was apprehensive. When I asked more about that, she said that she was afraid I was going to tell her to start cooking and eating things she wasn't comfortable with. And an hour before her call, we had practiced that very objection in our program, in my class. I was beyond prepared with a response, and so right from the start of the call, she was calmer and less anxious. It was beautiful. Joyce, I seriously wouldn't be in this place without our work together. I feel so much more confident to keep going and keep improving and to get my clients even better results. And then there's another text from V. And I was just saying to my husband last night how valuable your program is, and I wouldn't be able to be at this point in my business without the education and coaching you provide. I just wouldn't have the confidence to invite in more clients. So V is someone who has a private practice. She had been working as a dietitian for 15 years, inpatient, outpatient settings, but realized that she was missing some skills when she moved into private practice. So switching on to the last 2 tips. Tip number 5 is empower them with hope and optimism. So ask them any of these questions that I am providing here to be able to create affirmations. If you're familiar with motivational interviewing, affirmations is one of the core micro skills. The micro skills are open-ended questions, affirmations, reflections, and summaries. So affirmations are basically hugs with words. And I love that definition of it. That's what one of my mentors said to me once, and I'm never going to forget it. Affirmations can be reflections, but their statements are going to highlight a client's strengths, efforts, intentions, skills, personal qualities that are going to help them feel better. So in order to realize or to assess what we can use for affirmations, you can ask your clients any of these. What personal strengths have made you successful in making changes in the past? And take note. What has helped so far when it comes to managing your health or health conditions? Describe a time in the past when you were successful in making a change. What was that like? And you can take those responses, reflect it back to them, and create affirmations based on these. You're very resilient. You were able to do this in the past. I know you can do it again. So when we craft affirmations, we're basically think of ourselves as a coach for, let's say, a sports team. Not the cheerleader. The cheerleader says, yay, way to go, score, score, score. A coach is going to be like, you have this in you. You were able to show this in practice. I know you can do it with practice this strategy. So it empowers clients with their own resourcefulness, their own skills based on what they have shared with you. So I recommend all my clients have at least one affirmation ready for each client session so that you can sneak that in there and help empower your clients. And last but not least, thank you for those of you who are stuck around. Tip number 6, avoid responding to your clients' failed attempts with a root cause problem analysis. So if a client says to you, I blew it this week, you respond in such a way that's going to inspire and empower change. Avoid the temptation to respond to your clients' complaints about their failure to meet their goals with a root cause problem analysis. This will weigh people down with more reasons not to change or to remain stuck. So without dismissing their problems, reframe the conversation in positive terms, and this will help them get back on track and avoid becoming attached to feelings of failure, even if they do think they failed. So what you can say instead is something like this. I hear that you're frustrated because you really wanted to make better choices this week. Tell me about what did work for you. And this can help bring about a positive reframing, a positive conversation towards the rest of the discussion. So I'm curious, if you're still here, which of these 3 strategies or any of the tips resonated with you that you would like to try out? And these are, you can feel free to write 1, 2, or 3 if any of these resonated with you or you would like to try them out. And I want to give you a minute for those. Okay, interesting. Number 3 is a winner. Oh, 1, 2, okay. So a mix of everything, okay. And I'm just skimming the surface, right? There's only so much we can do in an hour here. But I will say that I cover many of these in detail into strategies, scripts, what to say, in what situations should you say it in my program. So if you're still around, I'm going to go ahead and share what else you can do. As a dietitian, there's much more that we can do to empower our clients. We only went over a few strategies. I have many more that I can teach you in my Elevated Nutrition Counseling Blueprint program. So you work so hard to be where you're at, so hard to get your clients. You want to make sure they're able to support them. The lack of training you received up until now has not been your fault at all. Dietetic curriculum is just not ideal when it comes to behavior change or prioritizing these trainings. But what you do about it moving forward is entirely up to you. It's okay if you have to leave, you'll be getting the replay. So what if instead you knew exactly how to respond to your clients and you felt confident in your ability to provide effective nutrition counseling skills? This is where I'm starting to share what I have to offer. I just created a self-paced program, the Elevated Nutrition Counseling Blueprint, your ticket to higher retention, because I've spoken to so many dietitians recently and they're looking for something they can do on their own time. So I'm offering 2 different options. There's a self-paced program that also includes all the modules, which is about 48 modules, mini modules with different strategies for each situation, and a workbook. This is the workbook itself, so it's very thorough. So what clients are saying is that this course is very comprehensive. They love it, and the group has exceeded their expectations. I'm going to go ahead and just go over the framework itself. So in the Elevated Nutrition Counseling Blueprint, we go over the foundations of behavior change, the therapeutic relationship and how to build it, the foundations of counseling on all the counseling skills, the stages of change and how to identify them and the correct interventions for each, the spirit of MI, the micro skills, putting all the process together and what it looks like in a counseling session. And with live support, you can also get into troubleshooting and discussion. So that's where we go into the practitioner mindset, case consults, and role play and discussion. So what if you could work on all of these to be able to really elevate your counseling skills? So what I'm offering right now includes different focuses. The first one is there's a heavy focus on the how to do effective nutrition counseling. This is the course library. Its value is $9.97. That's not what I'm charging. That's just the value. So this, all the modules are recorded that you can watch at your own pace. And here's some mini video so you can see what the modules look like. So it's 7+ hours of content. Defining success, challenges that might come up in a nutrition counseling session, how to tackle them. Dietitians have found this super valuable. Number 2, a workbook designed to help you implement each of the concepts with practice cases and prompts. And this I created using reverse course design to maximize your learning experience. Value $97. That's not where I'll be charging you, but this is a sneak peek of the workbook. You can see all the table of contents. That's also what I have here. And it also includes handouts with questions, prompts, activities, and scripts that you can use in your counseling sessions. These are some of the handouts. Crafting affirmations, how to tackle ambivalence in your client sessions, crafting habits to reach goals, ideas mapping activities, very useful handouts. And you can also get the replay of a body image coaching call that I had last month with a body image expert dietitian coach. So all of this valued at $14.94, you can get right now for $4.97. So you get lifetime access to all of the modules. Then you can also get the workbook and the access to the body image coaching call and all the handouts and scripts and activities to use in your sessions for $4.97. So I'm going to go ahead and share the link in case people want to read more about this. See everyone in meeting. Here's the link. But we all know that sharpening a skill requires support and mentoring. So I've also included separately a VIP upgrade, and this includes personalized feedback, ongoing support, opportunities to practice, implement, and live bi-weekly coaching call for 3 months. Because to me, that's where the magic tends to happen. You can do the self-paced course, get all the knowledge, and then once you're implementing and getting feedback, that's what's really valuable, right? So what are current participants saying about the coaching calls? Joyce, I'm learning so much. This is fabulous. Thank you. I wish I would have found you years ago. So these are clients who have been in the coaching calls with me. So this live bi-weekly group coaching calls for 3 months, it's going to be 75 minutes every other week. So it gives you an opportunity to practice. We role play, we implement, we have activities, and we do case consults in the live coaching calls. And there's also a Facebook community where you can ask questions, Q&A threads, and I can answer those questions with a mini video, or I can answer them with a post. And this is the other way to access me through this VIP upgrade. So all of this is valued at $2,400, but you can get it for $797. So if you're someone who's interested in just the self-paced option, entirely valid. You can do the self-paced course with the workbook, work at your own leisure, and then you can jump into the VIP upgrade maybe later once you've done everything. Or the option number 2 is to get the VIP upgrade. So you get the self-paced course, the workbook, plus the live coaching call starting in July. They're not going to start in June, maybe starting in July. But if you do join the VIP upgrade, you would start getting access to the Facebook community now, so I can answer some of those questions for you. So these are the 2 options for those of you who are still around and you might be interested. You can go ahead and check out the website. And this is the link on the chat. Or if individuals want to go ahead and schedule a discovery calls so that I can answer any of your questions, then this is the link to the discovery call, or to, the calendar, should I say. So I'm just going to go ahead and leave this here. And I'd like to ask you, do you have any questions about the program itself, or about the offers, or any burning questions about the content? I want to stick around in case anyone does. A big thank you to everyone who is here. And the replay will be sent out via email if you register for this. And you will also be getting the CEU certificate of completion once I get it. CDR has been taking a little while, so it might be a week or 2 until I send it out, but you will be getting it. I'm just going to leave this here in case anyone has any more questions. Otherwise, thank you so much. I hope you found this helpful. And feel free to reach out to me if you have any questions. Send me an email, nutritioncounselingacademy@gmail.com. You can find me on Instagram, Nutrition Counseling Academy, or you can join the Facebook community. And I would love to chat with each and every one of you if you have any questions. Thank you so much for coming. Thanks, everyone.